Hi, this is Dr. Sinagra. I'm here with my patient, Bill Ferrara. It is March 9th, 2015. Good afternoon, Bill. How are you?
Good. How are you?
Good. This is really casual. What we like to do with our patients is we like them to give us a video testimonial, so patients that or prospective patients that are scanning our website or the internet, it's really nice when you go, hey, I had that problem and this guy did good. Now, you're a young man. How old are you?
22.
Okay. I remember you very clear because you were a very unique case for 22 years of age. You came in with a lot of situations with brain fog, memory, and you don't usually see someone your age with brain conditions. And when we say brain conditions, people are like, oh, you know, your brain malfunctions like your stomach malfunctions, like your liver can malfunction. It's an organ. So tell me what was going on with your life and when this happened and what was going on.
Well, I was away at school. Studying 12, 15 hours every day in the library. Nothing seemed to stick. I was dealing with severe depression. I knew something was wrong, intense headaches, and my memory was basically shot. So I knew I needed to reach out and get some help.
Were you having, like, you know, when we describe brain fog to people, I always say, you know, is it like the 100-watt bulb was at 60 watts? Like you just didn't feel like your brain was lit up the way it should be?
Yeah, definitely.
Tell me about the memory problems, because for a man 22 years of age, you know, memory should not be an issue. And one of the things that we always stress is that brain function and memory function are not age related. What does that mean? Well, a lot of times people will say, you know, well, I'm 50, I'm 60, all the research proves there's people that are 90 years old that have perfect brain function. So it's not necessarily a byproduct of aging, but at 22, there's no way you should have anything. So of all of them, what was the most dramatic?
For me, it was really two things. One would be if I was sitting in a lecture and I was taking down notes, I would notice that the professor would get maybe 2 or 3 words ahead of what I'd written down, and I couldn't remember what the guy said. And I knew that was a problem. And then the other thing... And
that wasn't prior to this outbreak?
I never had an issue with that.
Now, you went to medical doctors for this condition, and what was their diagnosis and what was their treatment?
None. They had always cleared me. They said I was healthy and pushed me out the door.
Yeah, and you said you had some problems with depression. Were you on medication for that?
Nope. No.
So they basically said it wasn't even a clinical depression where you would do good from a Paxil or a Zoloft or nothing. Okay. So your mom finds our office on the internet. I'm assuming, I believe she did. You come in. What was your first impression? Did you think it was going to work? Were you a little skeptical?
I was definitely a little skeptical just because I'd never tried anything like this before, but I came in with an open mind because I knew something was wrong, and my regular physician had cleared me really for years, even though I had known little things were off, and then lately they told me I was still fine.
Yeah. Do you remember the first thing I said to you what the first problem was?
Not really.
Do you remember when I said it was your eating habits?
Yes.
Yeah, when you were going long periods of time. In the wellness center, the main thing is we look at you totally. So we look at your diet, we look at brain function, we look at adrenal function, we look at thyroid function, immune function, gut function, and so on. So when you first came in, I changed your diet. I took x-rays of your upper cervical spine. We started clearing out your upper cervical neck because you had a heavy-duty subluxation in your upper neck, misalignment of the upper neck. Then we set you off on our program to rebuild you metabolically. You were just about halfway through the program, correct?
Yes.
Tell me how much improvement you had.
Honestly, I don't even know how to measure it. It's amazing. I feel like a completely different person.
And how long did it take?
A few weeks.
A few weeks. How long did you suffer?
Several months.
Yeah, and it was good. Now, isn't it amazing that by saying, look, we're going to change your diet, remove inflammatory foods, remove foods that you're allergic to, have you eat consistently every 2 to 3 hours instead of going you were going 12, 18 hours without eating. Yeah. You're plummeting your blood sugar, causing havoc on you metabolically. Obviously, the stress, the biomechanical stress on your upper neck was dramatic due to long periods in the library. In 2 weeks, you were feeling better. You're halfway there. Would you say you're 95% plus improved?
Oh, absolutely.
Yeah. So what would you say to someone who's listening that has any type of brain malfunction, meaning memory loss, brain fog, brain fatigue, don't feel like they're as sharp as they used to be?
I would definitely say to anyone suffering from anything that I suffered from, or even anything else, get it checked out. Come here, because that was the best thing I did.
Now tell me about your depression.
There's not really much to say. It would just come in waves. I couldn't really control it.
Yeah, how about now?
Now I'm in complete control.
Yeah. Now one of the things is when Bill came in, we asked you a lot of brain function questions, and you had yeses on so many. We knew it wasn't a brain problem. Really, your problem was the steady flow of glucose, which your brain requires for energy, and also the steady flow of insulin. Too much insulin or too little insulin affects your brain's ability to function properly, and also to get the precursors for your neurotransmitters into the brain itself. So you're doing great. We thank you for this. Always, I forgot to ask you this at the beginning. Were you compensated in any way for doing this?
No.
Okay. Well, thank you so much for your time. I appreciate it. Very good.